Welcome to Module 6, Residents with Special Needs. Please refer to Chapters 15, 19 through 23, and 27. Objectives. There are numerous objectives in this unit. For comprehensive learning, all students must prepare to study and learn these key points. Obtain basic understanding of the gastrointestinal system. Identify qualities of bowel elimination. Obtain basic understanding of the cardiovascular system. Identify common signs and symptoms of circulatory disorders. Obtain basic understanding of the respiratory system and common signs or symptoms of respiratory disorders. Obtain basic understanding of the nervous system. Describe care for residents with neurological disorders, including dementia. Obtain basic understanding of the endocrine system. Identify signs or symptoms of diabetes and when to report to the nurse, recognize feelings for end-of-life care, and understanding hospice care. Chapter 15, the gastrointestinal system. Our first chapter on the GI system, for short, gastro means stomach and intestinal means bowel. The anatomy photo identifies the organs included that we use to digest food and process waste. Notice the gastrointestinal system begins at the mouth and is continuous all the way to the anus. Intestinal anatomy and physiology. The upper GI includes the mouth, esophagus, and stomach. The lower GI includes the intestines. The small intestine is first. It functions to absorb our nutrition and fluid from foods and liquids we consume. The large intestine receives what remains after this process, forms waste products into feces, and transports the waste to be excreted from the body. A bowel movement is the result of waste being passed from the body, also called BM for short, stool or feces. Using the appropriate term is important. Normal bowel elimination includes regular bowel movements. Stool is normally brown, soft, and formed. Pain, blood, pus, mucus, or worms are not a normal part of passing stool. Factors affecting elimination. This may include growth and development, as aging affects regularity. Psychological factors, such as lack of privacy and timely assistance to use toilet facility. Diet may contain foods that slow or increase bowel movement. Examples include the amount of fiber, fat content, meat, dairy, and even caffeine. Fluid intake. Decreased fluid consumption leads to dehydration and delayed absorption. This can cause constipation. Physical movement, or lack thereof, weakens muscles around the abdomen and pelvis. Personal habits, such as daily routine and positioning, are important considerations. The best position for elimination is squatting and leaning forward. Finally, medication. Some medication, such as antibiotics, can lead to diarrhea, while others, such as pain medications, can cause constipation. Expected changes that are a part of aging include ability to taste decreases. Process of digestion takes longer and is less efficient. Body waste moves more slowly, causing more frequent constipation. Difficulty chewing and swallowing can occur. Production of saliva and digestive fluids decreases. Knowing these normal changes will help you better recognize and understand what is abnormal for the body as a person ages. Complications of the gastrointestinal system are not normal conditions. Gastroesophageal reflux disease, or GERD, diverticulosis, diverticulitis, constipation, impaction, and hemorrhoids are several common disorders that residents may experience. You will need to understand and be prepared to identify these complications. Please refer to the literature, pages 280 through 283. Other issues, including heartburn and flatulence, also called gas or flatus, and fecal incontinence, which is involuntary passage of feces, is another type of complication in the GI system. This image depicts the disorders diverticulosis and diverticulitis. With diverticulitis, stool and bacteria become trapped inside the pouchings or sacs created from the disorder of diverticulosis. This causes pain and fever. As the condition worsens, the intestine can tear. Surgery is sometimes necessary. Other treatment includes rest, medication to reduce inflammation and infection, and a special diet that avoids small food that can become lodged in the sacs, such as nuts and seeds. The CNA is responsible to report all abnormal symptoms to the nurse promptly. Report blood, abnormal color, light or dark feces, worms, hard or liquid stool, complaints of difficulty passing stool, or pain, pus, mucus, or discharge, and any changes in incontinency. Some residents are routinely incontinent of feces. Always check their care plan or ask a nurse if you are unsure what is routine for the resident in your care. These images relate to nursing interventions for residents. The nurse will implement these measures and may ask for a CNA's assistance. Suppositories and enemas are medications that are given rectally. These may be laxatives that stimulate a bowel movement. Stool specimen collection may be necessary for testing of blood or bacteria. A small sample of a bowel movement is collected and sent to a laboratory for analysis. The CNA may need to collect the sample while providing care. It is important to collect a stool specimen that has not been in contact with urine. Collection devices may be used in a toilet or commode to catch stool, or a sample can be collected from an incontinence pad. Communication with nurses and documentation will ensure that interventions have been completed and determine effective treatment. Support the resident by positioning and comforting them during and after these procedures. An alternative to bowel elimination is by ostomy. This is a specifically created outside opening of the body by a specialized surgeon for elimination. The ostomy may be created from the ileum, which is known as an ileostomy, or the colon, which is known as a colostomy. The ostomy may be necessary due to infected, injured, or diseased areas on the bowel, or from an impaction of feces that cause severe damage. The word stoma is the word for artificial opening. Skin surrounding the stoma requires a regimen of care which usually maintains good skin integrity, keeping the skin and stoma healthy. The first picture to the left shows a pink, healthy colostomy. The stoma is uncovered. The color is a dark pink. The surrounding skin is in good condition and circulation is adequate to the tissue. The second picture shows a different stoma. Notice the color is deeper in red and the stoma is inflamed. The skin surrounding the stoma is raw and irritated. Fecal output may be causing irritation or another skin reaction may have occurred. The final picture to the right shows what unattached colostomy bags look like. They are called colostomy bags because they cover the stoma and collect the feces that leak from the stoma. CNAs are frequently delegated to empty colostomy bags. The resident may be able to assist depending on their level of independence. Colostomy care is not a part of lab for this class. The next slide shares information on ostomy care. Please refer to the literature, pages 291 and 292 in your textbook. Ostomy care. You will need to check the care plan for instructions, provide hand hygiene to self and the resident, follow standard and/or transmission-based precautions, observe the contents of the ostomy bag. Before removing the appliance, allow a little air out of the bag. We call this burping. Empty, clean, and replace the bag whenever stool is eliminated as needed. Observe skin around the stoma for irritation, rashes, swelling, or bleeding. Make sure the bottom of the appliance bag is securely clamped when you reapply it. Attach the bag securely. Inspect for leaks of air or liquid around the appliance. Be supportive, empathetic, and caring throughout the procedure. As a CNA, always be sensitive to the resident situation. Some residents may be self-conscious about their appearance or the presence of odors. This is a private matter. Maintain privacy during all cares and when having conversations regarding ostomy with your coworkers. Respect the dignity of the resident. Prevention of bowel irregularities is important. However, there are instances when irregularities can be reversed. At times, ostomies can be surgically reversed after the bowel has healed. Bowel retraining refers to helping residents reestablish control of passing bowel movements. To achieve this, we can support and assist residents to go to the bathroom at the same time of day to establish regularity and routine for their body. Our attitude and support can make a huge difference. Residents may need motivation and confidence. Remember to encourage and offer fluid intake.